Spreading from person to person, the coronavirus has already mutated several times. This latest variant is said to be more contagious, but
there's zero evidence at this point that there's any increase in severity associated with this disease. Clearly, work is ongoing to look at transmission and the increased rates of transmission and how much of that is attributable to this particular variant.
scientists say the mutations are in the virus's spikes, making it better at infecting people, resulting in a higher reproduction or infection rate. In Canada, the current rate averages 1.1, meaning 10 infected people today can turn into 18 infections in a week. This new variant's rate is estimated at 1.5, so in a week, 10 people can become 114. In a month, it's thousands. It's only a model. The more pressing matter, whether the new vaccines will still be effective.
Whether or not we can look at antibodies from patients that have been vaccinated and identify whether those antibodies still neutralize this new variant of the virus.
The two frontrunner vaccines are engineered to attack the coronavirus's spikes based on their genetic information and can be reprogrammed.
An mRNA vaccine, as the Pfizer and Moderna ones, actually have that capability of where the mRNA can actually be synthesized differently if needed. So there is some room for movement and improvement should that happen.
It all depends on whether Canadian labs can quickly detect these mutations.
We may be lucky this time. This particular virus may not be more virulent, but we need to do surveillance for enhanced virulence.
For now, the new variant doesn't change the latest public health advice. If anything, it calls for more vigilance. Vic Adopia, CBC News, Toronto.